I was somebody that had burnout on numerous occasions, and I had to do something about it.
Here at the McGill University Health Centre, nearly 7% of nurses were on sick leave last November, part of a Quebec-wide total of 4,500 nurses who were sidelined by illness or injury in the public network.
My burnout was no longer allowing me to care for people properly, and my body spoke volumes. I was diagnosed with hypertension, I was diagnosed with PCOS, I had fertility problems.
A lot of us, the healthcare professionals, are going home exhausted at the end of the day, wondering, oh my gosh, did I do everything I needed to do? And it's that added weight, that burden, that fear that we didn't do everything that we needed to do in a shift.
Now, more than 50% of the leaves are due to mental health challenges, and the pressure comes from everywhere. It's not just work. There's family obligations, there's financial stressors, there's other factors at play.
The typical demographic profile of a nurse is a woman who's in her early 40s, has young children at home. And so it's important to offer a work environment that allows them to have work and family balance.
But health advocates warn burnout doesn't just affect workers, it can ripple through the entire system. Budget pressures, they say, often delay equipment, upgrades and workplace improvements, increasing the risk of injury on the job.
So we've been told by Santé Quebec that we must, cut back. We're in a deficit of 40 plus million. We have to find the money somewhere. So certain things are not being replaced. Maybe old beds, old, civières like stretchers and things like that.
Union leaders also warn that when nurses are off sick, the remaining staff, including new graduates, are left with fewer supports.
You have new graduates who are by themselves. The more experienced ones are retiring, or they're off sick, or something is going on, and they're by themselves and they don't have the experience perhaps.
Experts say a 5% absence rate should be the maximum acceptable in a healthcare system, but many regions, including Montreal, are seeing well above that.
We've been treating this issue for the last 30 years as a shortage of nurses rather than a crisis in retention of nurses.
And despite 80,000 nurses across Quebec, the province has struggled with shortages for years. Santé Quebec says today 9% of those nurses are on leave.
What we need is proper ratios. We're going to be launching a project called the Ratio Project, heading into the next negotiations that is set for 2028.
And that staffing ratio model already exists elsewhere, where nurse assignments are based on patient acuity, ensuring staffing levels match care needs.
We deserve to have a quality of life outside of the workplace.
In Montreal, Lola Kalder, City News.